CBS News has confirmed that a 6th migrant child is known to have died after crossing into the U.S. The Health and Human Services Department said yesterday that the little 10-year-old girl died 8 months ago. Omar Villafranca is at the Border Patrol Processing Center in McAllen, Texas, with more on this story. Omar, good morning to you.
Good morning. Many children are brought to this processing center, but just to be clear, the little girl who died in September did not die here. But the head of the Hispanic Congressional Caucus is accusing the Trump administration of trying to cover up her death. The Department of Health and Human Services tells CBS News that in March 2018, a 10-year-old girl entered the care of the Office of Refugee Resettlement in San Antonio. They say she had a history of congenital heart defects and following a surgical procedure, became comatose. Then, in September, at a hospital near family in Nebraska, she died due to fever and respiratory distress. The revelation comes just days after Carlos Hernandez died while in Border Patrol custody. The 16-year-old from Guatemala was diagnosed with the flu at the main Border Patrol processing facility in McAllen. Intake of migrants at that facility was temporarily suspended Tuesday after 32 people were diagnosed with the flu.
We continue to face tragedies at the border, particularly with regard to the safety of children.
On Capitol Hill Wednesday, Acting Secretary of Homeland Security Kevin McAleenan was confronted by Illinois Democrat Lauren Underwood about the situation at the border.
At this point, with 5 kids that have died, 5,000 separated from their families, I feel like, and the evidence is really clear, that this is intentional. It's intentional. It's a policy choice being made on purpose by this administration, and it's cruel and inhumane.
That's an appalling accusation, and our men and women fight hard to protect people in our custody every single day.
This will not be the last death. There are going to be more.
Catherine Hampton works for the advocacy group Physicians for Human Rights. She says these deaths are an inevitable consequence of a system that detains thousands of migrant children.
The entire medical community have been warning that this is going to happen. What I'm most terrified of in this moment is that we're going to become so desensitized that these deaths don't mean anything anymore.
Here at the McAllen Processing Center, the Border Patrol told us to stop the spread of the flu. They sanitized the building, they did more medical assessments, and they also gave medical care where it was needed. And after all that, normal operations resumed yesterday afternoon. Tony?
Omar, just more great reporting from you and your team down there. I guess the big question now is, why are we only hearing today about that child's death if it happened all the way back in September?
Interesting note, because government agencies like HHS or ORR don't have to publicly report a migrant child's death. They just have to report it internally and to child welfare groups, and that may be one of the reasons why we're just hearing about it now.
Yeah, and I certainly hope it's the last one. Omar, thank you very much.